think when you look at what occurred at Sleep 2024 in Houston, Texas, it is really quite incredible to realize that this has been the largest sleep conference since COVID. There were over 5,000 attendees who were bringing in the most rich data to understand really what is the current, but also the future directions of sleep medicine. When we're looking at what the future directions are, there are some really hot topics that we must have a discussion about. So first and foremost, what has been in the news anyway? We're talking about the Wegovys, the Ozempics, the Zepbound. We're talking about the GLP-1 agonists. And so you may be asking yourself, what does this have anything to do in regards to sleep medicine? Well, Eli Lilly is having their phase 3 data, their top line data is available currently. And they are going to be revealing this actually very, very soon at one of the upcoming diabetes and endocrinology conferences, discussing this in exquisite detail. However, I was privileged to be a part of several different CME events where we started to have some of the discussion around what is the role of this medication in obstructive sleep apnea. That's right. We're talking about tirzepatide and what its role is in regards to the treatment of obstructive sleep apnea. So what we know is that there were several phase 3 components to this study where they had looked at individuals with moderate severe obstructive sleep apnea who are overweight to obese with and without CPAP. What we've identified is that there was significant reduction in the overall AHI, the apnea-hypopnea index. And so some may say, well, you're causing weight loss. Of course, you saw a reduction. However, with what most studies are saying is that with every 1% change in body weight, we see a 2.6% reduction in AHI. We saw more of a significant impact than that. In addition to that, we saw that those who were using CPAP had experienced even more of a benefit. This is something that is really important for us to take note of because of the fact that when we talk about the use of CPAP in adults, there's the question as to whether or not it actually is associated with weight loss versus weight gain. And so for those individuals who are using their CPAP adherently but are experiencing that weight gain, this is giving us another additional tool in our tool belt. One of the things that I'd like to share is that we shouldn't stop there just thinking about weight loss and its role in regards to the treatment of obstructive sleep apnea. When we're talking about GLP-1 agonism, it is really important to understand the physiology doesn't stop there. It has both direct and indirect interactions with the orexin system, both centrally and peripherally. Orexin is the Hail Mary in regards to what we're talking about in being able to promote wakefulness and also has a significant role in sleep stability. So we're really looking at a multifactorial approach to treating obstructive sleep apnea. And that really is going to be a game changer and an additional tool in our tool belt that is really going to benefit the majority of individuals with obstructive sleep apnea when recognizing in the United States, 75% of adults are overweight or obese, which means it's more than likely that if you're treating someone with obstructive sleep apnea, they may be also struggling with really managing their weight. I think really what we're looking at when we're talking about some of the conditions that are not getting the attention that they probably do deserve because they're dismissed as rare conditions, some of those would be our central disorders of hypersomnolence. What am I talking about? Narcolepsy, idiopathic hypersomnia are some examples of these. There was tremendous data that was put out at this conference that really is giving a lot of hope of expanding opportunity to not only better understand these conditions, what the true prevalence of these conditions are, but also life-changing treatment options that are on the horizon. So we saw coming out of France, Yves Dauvier, looking at the utilization of sodium oxybate, twice nightly sodium oxybate for the treatment of idiopathic hypersomnia. We know in the United States, we have the mixed salts oxybate that has been already approved for the treatment of idiopathic hypersomnia with very substantial benefit on the idiopathic hypersomnia severity scale, as well as the Epworth sleepiness scale. However, with that pivotal study, there was not any objective data to demonstrate objectively the degree of improvement. With Eve's study, what we see is that he performed a randomized control trial, which is again different because this was a double-blind randomized withdrawal trial for the pivotal trial. He did a randomized control trial and included not only those subjective scales, but also the maintenance of wakefulness test. He saw the same degree of robust improvement that we've seen with the mixed salts oxybate. The reason this is really important is because he not only replicated this, utilizing sodium oxybate for the subjective, but the degree of improvement was greater than 15 minutes on the maintenance of wakefulness test, really seeing a normalization of the ability to maintain wakefulness. When we're seeing that we're improving the Epworth, the idiopathic hypersomnia severity scale that is looking at the full 360 degrees of a person's day and demonstrating subjective improvements and objective improvements, that is something that is extraordinarily promising. I'll be looking forward in future research to see how the once nightly sodium oxybate may be making a difference in that patient population as well. The excitement doesn't stop there, however. What we also know is that as a board of directors member for the Sleep Research Society Foundation, I had the privilege of being able to chair one of our industry roundtables talking about central disorders of hypersomnolence. With that, I was alongside some of my esteemed colleagues like Tom Scammell, Emmanuel Mignot, Yves Davier, and many others from across the globe. We were able to review some of the recent evaluations that David Plant, who also was present, had done, looking at the Wisconsin sleep cohort. When we look at the Wisconsin sleep cohort, there was really robust evaluation of what are the possible sleep considerations that may be occurring in this population. What was found when doing a really detailed review of this is that likely about 1.5% of individuals in the Wisconsin sleep cohort met criteria for idiopathic hypersomnia. This is striking because we call idiopathic hypersomnia and narcolepsy rare diseases because we believe that they are representing less than 1 in 2,000 individuals. However, when looking at statistics of potentially 1.5%, we're approaching the prevalence that is similar to conditions like epilepsy, which I think for me are probably more accurate. Now, along the horizon of what really stole the show at this year's sleep conference, it's going to be the orexin agonist. We see that this is the race, the competition that we're now evaluating about a dozen different companies to be able to achieve getting to that finish line. The current leader in the race is definitely looking at the TAK-861, where it has completed its phase 2 study and now is entering into phase 3. But this was the first time of actually being able to look at the robust data that they have from the phase 2, which is demonstrating a very, very amazing improvement in excessive daytime sleepiness and cataplexy. Remember from the TAK-994, where there was an early termination of the study because of the concern about some liver toxicity. This was published in New England Journal of Medicine last year. We had seen groundbreaking data that we have never seen before for any narcolepsy treatments. What do I mean by that? We saw normalizations of maintenance of wakefulness tests. We saw that people were achieving complete cataplexy freedom. And when you talk to some of the investigators who participated in these trials, they would say, our patients are saying, I no longer have narcolepsy. They were experiencing a normalization. So this was devastating to see TAK-994 and its study. However, it is just awe and inspiring to be able to see that TAK-861 is demonstrating very, very similar efficacy with great safety profiles. Not too far behind TAK-861 is ALKS 2680, which is another orexin 2 agonist, which has just finished its phase 1 data and will be entering into its phase 2. And again, demonstrating with a single dose some really robust, profound improvements in a really satisfying safety profile that really is going to lead to likely a successful phase 2. With these medications coming so close to being able to participate in phase 2 and phase 3 trials, it's anticipated we may be seeing these drugs on the market as early as 2027, 2028. Let me tell you, although you as a sleep doctor may be saying, well, I don't really see that much narcolepsy, one, make sure you're looking for it because I guarantee you it's in your practice. But number two, what we know is that with the role of orexin, it far exceeds just the treatment of central disorders of hypersomnolence. We know that it's likely going to have a role in circadian rhythm disorders as well as sleep disorder breathing. So when these drugs come to market, they are going to be blockbuster drugs that are going to transform our clinical practice and hopefully transform our patients' lives. I think when looking at what are going to be the upcoming sleep conferences that people get excited about, it really depends on what discipline you're coming from. For a pulmonologist next year, looking at ATS and chest. I think for most sleep docs, it's always looking at the big one every year of Sleep 2025 for next year, which will be held in Seattle. However, in 2025, we also are going to see World Sleep Society's Congress, and that's going to be held in Singapore. That really is going to be something that does draw a really great international presence, examining science from all over the globe. And again, another one that really just should not be missed.